Dr. Abubakar Saidu, a consultant physician in the Department of Medicine here. He also a board chairman at NITA. Thank you for coming, sir. The special guest of honor, the Executive Secretary, Gombe State Primary Healthcare Development Agency, Dr. Abdurrahman Shaibu. Thank you for coming. The presenter and the president, Papilloma Virus Society of Gombe, Nigeria, Professor Mohamed Manga, and the provost, Gombe State University, and consultant medical microbiologist and immunologist here in Federal Teaching Hospital, Gombe. My fellow discussants, Dr. Joshua Abubakar Ifa, Deputy Provost, Gombe State University, and Senior Consultant, Community Medicine here in Federal Teaching Hospital, Gombe, and Dr. Farouk, Halima Farouk. She is also a member of the Gombe, Papilloma Virus Society of Gombe, Nigeria. She's a head of department, gynecology here in Federal Teaching Hospital, Gombe, and a lecturer in Gombe State University. So, invited guests, you are all welcome, and thank you for gracing this occasion. Part of what I want to also add, Dr. Manga has done a lot. I will be doing more of the community, although what he presented actually encompasses all. But I wanted to start by saying that just recently, about 2 days ago, Dr. Zainab Shinkapibagudu, the First Lady, Kebbi State, she is a board member at Union International on Cancer Control, the chair, First Ladies Against Cancer. I mean, she just wears a lot of shoes and caps. She has been doing a tremendous job regarding cancer control, women, child health, etc. So I just saw that she posted they had a meeting between Gavi and UICC, including important stakeholders in Nigeria, like the Executive Secretary, or let me say the Director General of the Nigerian Primary Healthcare Development Agency. And part of the efforts they are making, or what she actually said, is that very soon HPV vaccine is going to be available. Of course, it's already on the schedule, as Professor Manga mentioned or stated. But what she said, well, we know that it's actually difficult to get. It's quite difficult to get, but now it's almost going to be available. Thank God we have one of us, Professor Mohamed Pate, now, who is the overall Oga of Gavi in the whole world. So hopefully things will actually continue to be better in the Nigerian way. So regarding the community, I actually took special interest in community, let me say, cancer care or public health cancer care when I actually found myself in University of Ibadan Radiotherapy Department. I felt like I should just stop because at that point things were not really interesting. I wanted to see things bubbling things, but of course with cancer at times it's not like that. There and then I took the decision that I will have to go to the community because I felt most of the patients come with advanced disease, and as you understand, the outcome is actually going to be a bit poor. And this is not only cervical cancer, but quite a number of the cancers. And so I felt like if I go to the community, do a lot of education, screening, and advocacy for vaccination, etc. Honestly speaking, I might not measure the impact of what I have done, but inside me, I'll be like appeased, or I will be happy that I'm doing something. So that was what actually drove me to the community. And thereafter, I decided to go and get a master's in epidemiology and medical statistics and a PhD in primary healthcare epidemiology at the University of Edinburgh. And so most of my researches were actually done in Gombe or at the level of sub-Saharan Africa. And to tell you, my PhD, after having like hit my head, I just couldn't get anything to research on. And so I now ask myself that we know Africa is a very resourceful place. We have a lot of good culture. As you know, if any of you that happen to live abroad, you will realize that you actually don't have your relatives and the community around you the way it is in Africa. It's not like they don't support their people, but it's not the way it is in Africa. You have neighbors, you have relatives, you have grandchildren, grandparents, and everyone around you. And this is one concept that I actually studied. Frankly speaking, when I was there, I discussed with Dr. Manga, and part of our discussion, he said, is that as far as Nigeria is concerned, most of the things we can study, which is not really studied well outside Nigeria or in developed countries, is the community. I mean, attitude, behavior, what happens in the community. And ultimately, I decided to actually coin my research question around it. And so for my PhD, my research question is that are there opportunities in the community that we can use or we can harness to increase uptake and control of cervical cancer, or let me say improve uptake of cervical cancer screening. And so what I did is to have 3 research questions under it. And the first one is, are there actually evidence or indication that the community itself is involved in improving uptake of cervical cancer screening? And for that, I did a systematic review at the level of sub-Saharan Africa. And essentially what I found are that, one, the communities are actually involved. And how are they involved? I actually mapped it such that at the level of community, what I did is to see what is there in the community that I can actually lay my hands on. And so what I did is to look at some primary care level structures like community health workers. And for community health workers, I decided to look at a broad range of, not just the guys that were trained in community College of Health Sciences like the CHU, the JCHU, but including, I mean, we have a lot of volunteers, peer educators, peer support, etc. I mean, even students and the rest. So these are, and in some other parts of Africa, there are some of these like in Ngozoma, in like places like Zambia and the rest. These are the equivalents of Ngozoma. So I look at all of them. And then community-based organizations, mosques, churches, women group, associations like Medical Women Association, etc. I looked at all of them, including traditional rulers as a group, etc. And what did I find? I found out that, like for the community health workers, they were actually very keen and, let me say, very supportive regarding increasing awareness or demand for cervical cancer screening. Mostly what they do is to provide awareness. They also help in increasing the access because they support screening. There are instances whereby these community health workers are actually trained. There is this concept of tax shifting. The gynecologist, Dr. Joshua, the community health physician, might also give us knowledge about the tax shifting from doctors to nurses, or from doctors to nurses and community health workers, or from nurses to community health workers, or even lay people to do some services. Of course, the WHO actually frowns at allowing community health workers to actually do screening, but of course they can do a lot of things. When you take the sample, they can convey it, they can take it to the lab, they can participate in awareness creation and the rest. And so further, they do some innovative things. And for the community-based organizations, like the churches, the mosques, and most of the organizations, we found out that they've done a lot of work around increasing, of course, demand, or let me say awareness and etc. for cervical cancer screening. More so, and very important, is that they've actually provided their own institutions in conducting screening and this awareness. We've known instances whereby we approach the imams and the pastors to actually help us in doing that. Dr. Manga mentioned that to help us in creating awareness and calling on people to come and take up screening, etc. We've also used their, I mean, a lot of churches and mosques have actually their own hospitals that people can go there and get screening. And these are some of the support they actually give. And further, for some of these community health workers, so let me yeah, thank you, sir.
I noticed that the light is off.
Okay, thank you, sir.
But
so,
you have only 1 minute to round up.
Okay, thank you. So, the other research question is actually looking at the knowledge of cervical cancer and some of the preferences of screening behavior. And the third one is actually looking at readiness of communities in Gombe State for cervical cancer screening. For the awareness, I found out that surprisingly, I studied about 2,200 women in Gombe, and I found that 85% of women in the community actually are not aware of cervical cancer. And among these 15%, I found out that less than 30% of this 15%, actually, what I found out is that they, one, are mostly women in the villages. Two, they are usually educated, including their husbands, below secondary school. Most of them, the women don't actually access contraceptives. Some of them, or mostly, they are HIV positive women. Most of them are married. And of course, as Dr. Manga said, because most of the study, we studied Muslim women, because the proportion is 70 to 30, my demography of the women I studied, so most of them are actually Muslim women. And that's for the awareness. And for the preferences, I found out that there were key preferences. One is poor, low intention to take up cervical cancer screening. Two is that a lot of women have gender preferences. One of the other preferences or the behavior is the fact that they prefer to be accompanied to the hospital. And two, they actually want to get permission from their husbands or family to actually get screening. Some of these behaviors are actually a bit depressing, or that can discourage uptake, but some are actually, mostly they are related to actually cultural values and practices in the community, especially our own type of community. One, again, I now found that comparing HIV positive and HIV negative women, because I took time to go to a lot of HIV facilities to take samples, I found out that some of these cultural practices and values do not affect HIV women because of their frequent visit to hospital facilities. Then, regarding the qualitative study that I did, which is looking at readiness of communities for cervical cancer screening, I found mostly negative factors, such as low level of knowledge, poor attitude and behavior, insufficient resources and momentum for cervical screening, as well as a kind of poor contextual factors. I mean contextual factors, I mean high poverty, high knowledge, etc. And overall, what I found out is that communities are actually very important, although there are a lot of negative things. But what, again, very important that I found is a lot of high sense of community. We know we have high sense of community. Once something is wrong with you, there are so many people to come and support you, even if what they will support you is what you may know where you want exactly, but you are likely to get a support from the community. So this high sense of community is what I found that is very important, especially willingness to do. Of course, the resources are not there, but there is a lot of willingness from the communities. So overall, I found out that to actually have a successful screening, you have to actually do a lot concerning increasing uptake of screening. You have to consider the cultural values and practices of women and the community. And of course, we have a lot of structures that are on ground at the level of primary health care, at the level of HIV control, that we can leverage on and collaborate with these organizations and individuals. The primary health care, we have development agency, the state, we have NGOs and the rest. So once we collaborate with them, that's going to lead to a significant improvement in cervical cancer control. Thank you very much.